recognize we are closer to achieving serious health care reform that cuts costs, provides coverage to American families, allows them to keep their doctors, and plans that are working for them. We're closer to that significant reform than at any time in recent history.
I think healthcare in the United States, we need to have healthcare available to everyone, and like we need to have like national healthcare for everyone. So it is overpriced right now because some people who don't have insurance, they are not getting the care that they need. Right. When you have insurance, you get the care. If you don't have the proper insurance, you will just get the basics.
Do you believe healthcare is overpriced? In other words, is it expensive?
I believe it is expensive because as far as for me myself, I pay $120 a month, and even that's limited on my visits. I still have a co-payment to pay, and then some of the services are not covered. So I still pay a co-payment for my visits and plus co-payment from medication.
Okay. What do you think about the healthcare system in the U.S.?
I think the healthcare system needs to be more flexible with all the population, because some of us work many hours a month and we pay a lot from our pocket, including the co-payments and the visits. So I think when you're working extra hours, I think it should be less expensive or more economic for us. It's a little overpriced when you're paying $120 plus your visits and your medication.
Okay. Would you be willing to pay more taxes for a better healthcare system?
If it guarantees more coverage and less payment from our pocket, yes.
Yeah.
I think it's very expensive.
Yeah, I think it's overpriced.
It's very, yeah. I mean, if someone's uninsured, like my sister had to go to the emergency room for labs because she had an infection, and her medical bills were like $1,800, and all they did was do blood work.
Were you guys willing to pay more taxes to see these expensive prices of? Are you willing to pay more taxes?
More?
Yeah,
Well, we're paying more taxes
Insurance.
and a lot of other stuff,
Yes.
so I'd rather pay more taxes if it's going to benefit people,
yeah.
as a whole medically, not for other stupid
Oil
stuff.
funding.
yeah,
Exactly.
like the war and stuff.
Yes.
You guys are,
Yeah, right. I wouldn't.
unnecessary affairs that we need to pay for. I think that's absurd. I think we should pay for our own.
We should worry about ourselves,
Yes,
right? And
exactly.
instead of worrying about
Especially
other
the
people.
Coney
People,
thing.
yeah, exactly.
Yeah.
This whole Coney 2012.
In America, there are so many ways to keep from dying, and so when you do die, it's a really big deal because you think that there's some possibility that it could have been
Obviously,
prevented?
like some people don't have enough money to afford to pay for like really high cost surgeries or high cost operations. So like if we all pay a little bit, we can all help like each other out, and that's what you really should do, I think, as a nation in order to be supportive of one another.
Should everyone have healthcare?
Oh, of course.
Of course, right?
Yeah, yeah, necessary.
It should be accessible to everyone.
Right.
Okay. Another question. You currently have healthcare, right? Do you believe it's effective in the times that you've needed it?
For us, yes.
Yeah.
If you don't have health insurance, then what we're going to do is to provide you the option of buying into the same kind of federal pool that both Senator McCain and I enjoy as federal employees, which will give you high-quality care, choice of doctors at lower cost because so many people are part of this insured group. We're going to make sure that insurance companies can't discriminate on the basis of pre-existing conditions. We'll negotiate with the drug companies for the cheapest available price on drugs. We are going to invest in information technology to eliminate bureaucracy and make the system more efficient. And we are going to make sure that we manage chronic illnesses like diabetes and heart disease that cost a huge amount but could be prevented. We've got to put more money into preventive care. This will cost some money on the front end, but over the long term, this is the only way that not only are we going to make families healthy, but it's also how we're going to save the federal budget